In medicine, it's funny. Sometimes the most powerful, life saving tools are actually the simplest ones. Today, we're going to dive into a checklist for some of the scariest gastrointestinal emergencies out there. And the whole thing started with just a simple question between two doctors. Doctors and nurses quickly run through 6 deadly conditions that you just cannot afford to miss. Let's get into it.
All right, first up, the D stands for duodenal perforation. Now, the source material points to a really critical situation here, the patient with diabetes. For them, abdominal symptoms can be really quiet, almost silent, which makes a dangerous rupture just incredibly easy to overlook.
And that's exactly what makes it so incredibly dangerous, right? If you have a patient with diabetes, you've got to have a much higher level of suspicion. That silent abdomen isn't a good sign. It's a massive red flag. Recognizing it immediately is everything.
Let's move to the first R. This stands for rectal bleed, and specifically, one caused by a diverticular hemorrhage. The keywords here are sudden and within minutes. We're not talking about a slow leak. This is a catastrophic event, like a dam breaking. And this just paints the perfect and frankly terrifying clinical picture. A patient might look totally stable 1 minute, but then a sudden, sharp drop in their blood pressure is the signal that things are going downhill fast. The risk of going into life-threatening shock is incredibly high and happens unbelievably quickly. Next up is P for pancreatic cancer. Specifically, we're talking about cancer at the head of the pancreas. See, a lot of conditions scream for your attention with pain, but this one often whispers. The sign is so subtle, painless jaundice, that yellowing of the skin and eyes. And that is the warning sign. When the tumor blocks the bile duct, all that bilirubin backs up and causes that telltale yellow color. It's the silent, visual warning of something really, really serious happening just under the surface. All right, we've got another R to tackle in PREM. This one's for reduced flow. It's the medical term for acute mesenteric ischemia, basically a blocked artery cutting off blood to the intestines. The absolute classic clue here is a patient who is in just agonizing pain, but when you examine their stomach, it doesn't feel all that sore. And that mismatch, that's a huge red flag. Time literally equals bowel. Wow. Just let that one sink in for a second. It's such a stark way to put it, but it's the absolute truth. Every single minute that diagnosis is delayed means more of the intestine is literally dying. The urgency here is off the charts. So here's the bottom line. When you see that strange combination of terrible pain but a relatively normal physical exam, you have to immediately think about blood supply. Time is the #1 most critical factor in saving that person's bowel and maybe their life. Next, we have E for entrapment. Think of it like this, an internal hernia. It's a loop of the bowel that gets snagged and twisted on itself, kind of like a knot in a garden hose. This creates what's called a closed loop obstruction, which cuts off flow and eventually its own blood supply. It's a ticking time bomb.
And you know what makes this one so tricky? It can pop up in people who've never had surgery on their abdomen, so there's no scar tissue or obvious reason for it, which makes it a real diagnostic puzzle that you have to solve fast before that trapped tissue dies.
And that brings us to the final letter, M, for migratory pain. This is the classic, the one we all hear about, appendicitis. It's that pain that starts near the belly button and then moves or migrates over to the lower right side of the abdomen. And even though it's super common, you'd be surprised how often it can get missed or confused with something else.
Okay, so we've just walked through the whole thing letter by letter, DRPREM. But that brings us to the bigger question, doesn't it? In the middle of a high-stress, chaotic ER, with alarms going off and lives on the line, why would something as simple as a name be so incredibly valuable? Well, because it does all of this. It cuts right through the noise and the chaos and gives you an instant mental checklist. It gives your brain a structure for the diagnosis, so you don't forget one of these 6 critical possibilities. And in doing that, it saves you precious time. And as we just saw, that time can literally equal saving an organ or saving a life. And so there it is, the key unlocked. Duodenal perforation, rectal bleed, pancreatic cancer, reduced flow, entrapment, and migratory pain. A simple name that started as a question between 2 colleagues and turned into this powerful tool for thinking clearly and saving lives. And all of this leaves me with one final thought. This whole powerful tool seems to have started when one doctor, Dr. Akhani, just turned to his colleague and asked, "Dr. Prem, do you agree with me?"